In the United States of America, there are over 327 million people living there, and of that, over 400,000 people have contracted a fatal disease. Though 25,000 have managed to recover, over 16,000 have died due to complications of a disease known as the coronavirus. From what scientists and doctors tell us, the virus had originated in China and since has spread rapidly across the world. March 11, 2020, the World Health Organization declared the rapidly spreading coronavirus outbreak a pandemic.
We have therefore made the assessment that COVID-19 can be characterized as a pandemic.
Over 11,000 cases have been confirmed in the state of Texas and counting, with 222 fatalities reported and counting. Most cases have been confirmed in my hometown of Houston, with over 10,000 cases and 199 fatalities in 170 of 254 counties.
So there's a lot of debate about it, in fact, where it originated from, but I think the prevailing idea is that, so it's related to the SARS virus. It's a SARS-like coronavirus. And it, the prevailing idea, I think, still is that many of these viruses arise through recombination with other viruses and become more contagious, and that some of that is really from, animals being co-housed in wet markets and so forth, where they shouldn't be.
The SARS virus began in 2002 southern China on November 16th in Fashon, China, when a man ate a combination of chicken, cat, and snake. Then it started spreading when a man that got infected went to a hotel. SARS killed 774 people, 10% of those it infected. However, SARS wasn't as deadly as other viruses and seemingly just faded away. Coronavirus, or COVID-19, is the third zoonotic coronavirus after SARS, severe acute respiratory syndrome, and MERS, Middle East respiratory syndrome. But corona appears to be the only one on a pandemic level. Viruses are known to latch on from host to host. Viruses are also known to mutate once inside the human body. When a virus from an animal gets inside a human, it is then known as a zoonotic virus, which then results in viruses such as bird flu, which comes from birds, swine flu, which comes from pigs, HIV, which comes from chimps, and Ebola, which comes from bats.
Some researchers have looked at the sequence of the virus and have found evidence for sequences from an animal called a pangolin. The pangolin is like it's sort of funny because it kind of looks a little bit like an armadillo, but it's probably more related to an anteater. They're endangered, and they sometimes they're captured in various areas, and they show up in these wet markets. And there's a possibility that maybe the virus jumped, from one animal to another and acquired these pangolin sequences, and that might have made it more dangerous than it had been before.
When it comes to COVID-19, scientists aren't really sure what it originated from. What classifies a virus as deadly or dangerous is the rate of death by the rate of how contagious it is. Corona affects somewhere between 2 and 4 people, with the mortality rate being lower than 10%.
So it certainly is more deadly than, say, the flu. So there's a 5 to 7% mortality rate with this virus, whereas the flu is a much lower 1 to 2% rate. The flu, unlike this virus, because it's not as deadly but affects a broad number of people, can extinguish through the population without really harming or hospitalizing a large number of individuals. So we don't normally quarantine whole populations for the flu, for instance, although we are particularly interested sometimes in quarantining groups of people that might have a particular sensitivity to flu or pneumonia in those cases. There are other viruses that are even more deadly. like MERS, for instance, where the minute you get an infection, you need to be hospitalized. And that has the effect that those very severely affected people would be hospitalized immediately and then taken from the population. So they're quarantined immediately because of the severity of the disease.
Here in Houston, scientists and doctors are working on a vaccine. How vaccines worked is we get injected with proteins from the virus, and we create our own little molecules that attach to those proteins and neutralize the virus, known as antibodies, and allow it to be swept out the body. So when we get infected by the real virus, we can rapidly create an immune response, send out these antibodies, and get rid of the virus. However, doctors are yet to be successful in finding a vaccination, as the cases for COVID grow larger and larger day by day. More and more Houstonians grow impatient for waiting for this pandemic to be over. Some Houstonians choose not to wear protective gear as they go out. Wearing masks, wearing gloves, and protecting yourself is how we prevent the spread of this virus. This pandemic is not going away soon, so the objective is to stay safe and lower the curve. Slow down fatalities. Therefore, unless absolutely necessary, just stay inside. Movie theaters, parks, and malls, things that we all miss and enjoy, are still going to be there when this pandemic is over. Be patient and just stay inside.